Malaysia's medical inflation is spiralling, rising faster than wages and even faster than general inflation. In 2024 alone, the country saw a staggering 10 to 15% rise in healthcare costs, outpacing both global and Asia-Pacific averages. The impact: medical insurance premiums have jumped by as much as 70% in recent years, sparking public outrage. Many are calling the hikes unfair, especially for the elderly. Mr. Chia Tak Wing is one of them. The 64-year-old has been on the same insurance plan for decades, but in recent years, his premiums have surged, tripling from $520 in 2017 to about $1,500 by the end of 2024.
And I was shocked, so I asked my agent what is happening, because what was told when I first subscribed to the plan was different. I've been subscribing to that plan for 30, 40 years already, you know. And once you touch or reach 60 years old, wow, the increase was crazy, you know. I mean, it's just, in fact, I was even thinking of doing away with it because I cannot afford anymore.
Mr. Chia says he's not alone. Many retirees are dropping their insurance altogether and seeking care in already crowded public hospitals.
We definitely will see rising medical costs come into play because there's a huge pressure on medical advancement. So there's more techniques, more therapies available. We see patients surviving for much longer, but the cost of the drugs is that it's not cheap. We have an aging population in Singapore, in Malaysia, in actually a lot of Southeast Asia. Even Vietnam is moving into an aging population within the next half a decade. We need to really work with our providers and our regulators to see what's the best way for us to control these costs.
To cushion the blow from rising premiums, Malaysia's central bank has rolled out interim measures, including a temporary 10% cap on annual hikes for most policyholders and a one-year freeze for seniors on basic plans. It's also pushing for greater price transparency, with mandatory drug price displays in GP clinics starting from May 1st. But industry players argue the conversation must go beyond just price tags. They say healthcare inflation can't be blamed solely on insurers or patients, and that better education and transparency are needed.
The problem which we face is that the data is being presented differently by different agencies, by different parties. So that has caused a little bit of disconnect. Let's work together, and the togetherness will actually solve, if not all, but some of the issues for the proportion of patients who are finding it difficult to afford a premium or even to afford private health care.
Malaysia is expected to become an aged nation by 2040, and cracks are already starting to show. Rising premiums, overcrowded public hospitals and insufficient coverage are leaving many, especially seniors, behind, highlighting the urgent need for a more inclusive and affordable healthcare system. Afifah, Ariffin, CNA, Kuala Lumpur.